Hey, welcome to a field trip. Today we're up on the medical floor, and I have Miranda Benavidez.
Got it.
That last name's a tough one. I know Miranda forever, but the Benavidez is a tougher one for me to get out. But hey,
Yes.
Miranda is a nurse up here on the floor, and she's been up here for, it seems like,
Going on 4 years.
okay,
Yeah.
for quite a while now. And actually today she's the charge nurse, so which means she's kind of running the show, and she's helping us.
Yes.
Talking a little bit about what we do when patients have different kinds of precautions we need to have for them when they show up here to the medical floor. So I guess the first question I've had, Miranda, how do you know as the patients come up to the floor what kind of precautions they're going to need?
So usually we'll get a phone call from the lab that will tell us if they have anything specific in their labs that is like a positive blood culture, urine culture, anything like that.
Okay.
A lot of them we're familiar with, so we'll know what kind of isolation to put them on. Otherwise, we do have like a packet in the drawers that will tell us. And then there's these special signs that are inside of our drawers to put up there. If not, we can always ask Dr. Alkaloff too. He kind of helps us
He's our infectious disease
with
doctor,
other stuff that we get a few that we don't know. So.
Yeah, and if they come up and there's some sort of like you think they suspect it's pneumonia, or they suspect, that probably keys you in a little bit too about what. Yeah. Okay. All right. Yeah. And so obviously we're going to talk. We're talking now, but I'll have talked with Katie and Gina prior to our things showing up here on Facebook. But there are several different types of isolation.
Yeah.
And so on a floor like this, I can remember one day, it was last week, week before that, it seems like there are like 12 patients on various types of isolation, right?
Yeah.
That was a big sigh,
That's
right?
normal. I think we have like 5 today too. There's a lot. Yeah.
So first of all, how do you, for the nurse who's going to start seeing that patient that day, how does he or she know what kind of precautions it is and what to do?
So usually at our huddle in the morning, like at the beginning of each shift, day shift and night shift, we'll let them know what kind of isolation patients are on, and we just normally give them the room number, so that will help. And then there's also the signs on the walls that will help to tell us what kind of precautions it is and what you should look like when you're going in that room.
Okay. Yeah, that's a familiar face for those of you who are normally see. Yeah, somebody
Dr.
wrote,
Bird on the wall.
Yeah, someone. I think our marketing department roped me into taking a few pictures a few years ago. I didn't realize they were going to show up on the walls like that. But anyhow, that's one of our visuals. And then, can you talk us through what this is, Miranda?
Yes, so in the top drawer is usually where we'll keep like the stethoscopes that we use for the patients, and they're one patient use usually. We throw them away afterwards. But it will also have all of these different signs that give us like the different isolations that they need. Like this one's a different one for like airborne. It's just got the mask on. So that's usually there. And then as you go down, we have like all of our gloves and like booties, stuff like that we need. And then it kind of goes into the gowns and the extra supplies and stuff at the bottom. So
yeah, and I think the point is, I wanted to make for people who are watching too, that for the last 2 years we keep hearing about COVID, and that's important.
Right.
And we have precautions that we do for COVID patients, but there's a big bucket of patients who aren't COVID that you do this for as well.
Right.
Yeah. So I think that's the thing I want folks to realize, is that Miranda and her team have all the time patients up here who have some type of different thing that they need to be careful with for that patient as well as for themselves and for other patients and stuff in the area.
Right.
So yeah, I wanted to take just a moment with Miranda and talk through what we've done here at CGH to equip our rooms with what's called negative pressure. It's something that our maintenance department has done for, is it all of our rooms now, Miranda, that have this up on the
All of ours have them except for our 2 like behavioral rooms. Those
Okay.
can't have them in the windows, but all the rest of them do.
Yeah, so it allows, can you talk about what that allows then?
Yeah, so originally we only had 2 rooms that we could actually put a COVID patient in that were negative pressure. And with the influx of COVID we were getting, it just wasn't working. So they installed these nice fans in the windows that when they're turned on do make our rooms negative pressure, so we're able to use any of these rooms for COVID patients as long as the door is shut.
Yeah.
And maintenance can come around and check the outside, like underneath the door, to make sure that the pressure is what it needs to be. So.
And traditionally on the floor, do you have like maybe 2 or 3 negative pressure rooms all the time?
We have 2, yeah.
Yeah, and what kind of patient would typically be in that room besides, of course, your COVID folks?
Usually it's like a TB patient, if we're ruling out TB or something like that,
Yeah, some type of airborne infectious disease, that's what these are for. So if you're not a patient who needs that, this is what it looks like. And
Right.
then if you do happen to have,
And we do put these boxes on also because if you don't have them on, the draft that comes through these windows is horrendous.
yeah, okay.
It
Well,
gets
there we
very
go.
cold.
There we go. So I'm going to finish this, getting this off of here, just to show folks okay. So I'll hold that for you,
Got it.
Miranda. So yeah, this is, you want to talk about that?
Yeah, so they just get plugged into the wall, and then there's 3 different settings you can put them on. I believe as long as they're just on, it'll be negative pressure, but sometimes they're very loud, so we'll move them down to the lowest we can get them.
Yeah.
Because of the drafts and stuff like that too. But
Yeah.
yeah, as long as they're turned on, it makes the room be negative pressure. There's like vents on the outside that open when the fan is on, so everything is getting sucked outside.
So the concept there is you have a patient here who's in the bed, and what is that negative pressure allowing in terms of infection prevention thing to do?
Well, it's taking it all outside, so because we're all coming through the door, and before, like, you know, the vents and stuff would be in the ceiling. I know downstairs or in the bathroom, and everybody's kind of walking through that.
Right.
So these kind of allow everything to kind of go outwards, so you can like stand by the bed and not be, you know, breathing all that in. So.
Yeah, I almost think it's like almost making.
Sorry.
It's all right. Hey, she's working today. It's almost making, you know, we talk about like COVID is a lot less likely to spread when you're outside.
Right.
So it's almost making this inside outside.
Yeah.
Because it's like wind is blowing through and you're sucking that air out into the outside air. Is that kind of?
Yeah, and you can kind of hear it's trying to come through now. Yeah.
Yeah. You
with
can
it
a little
open.
bit. So. All right, very good. Well, thank you, Miranda. And,
You're welcome.
Thank you for all the good work you do up here on the medical floor to take care of our patients and keep them safe and keep them free of infection while they're here and everything.
You're welcome. We're certainly trying.
Okay, welcome again. I'm continuing our field trip, and I pulled in someone from Environmental Services. This is someone who's been on with me before. This is Maria Mariggs.
Yes.
Hi, Maria.
Hi, Dr. Bird.
Maria didn't know she was going to be on doing this until about 10 minutes ago, so she was very good sport with me about doing this. So thank you. But as we've talked about before with our environmental services team, they really are literally on the ground floor of keeping patients safe when they come to the hospital, and particularly if they have some type of precautions from an infection control standpoint that they need to have. So Maria, the question I wanted to ask you when we're talking about infection prevention is when there are patients in the rooms that have different kinds of precautions, contact, droplet, you know, whatever.
Yes.
Do you go about cleaning those rooms any differently for those particular patients?
Yes, I do.
Okay.
We have these cards that we put on the outside.
Yep.
And what we do, whatever the sign says, we do, because some people may come here with just an infection. Some are here reverse isolation, and whatever we take in, we could make them sicker. So we have to make sure that we sanitize our hands, do everything like we should. And so whatever the sign says, I do.
Okay.
And sometimes we have to do it with bleach. Sometimes.
So who would you do, what kind of patient would you do bleach with? Is that more the contact?
Yes, it's contact plus it's C. diff.
Yeah, so.
Everything has to be done with bleach, and then we rinse it all off.
Yeah.
And so
Yeah.
it's a pretty nasty infection, so you really want to clean it really, really good.
Yep. Yeah. Maria's team does a great job with that, and so yeah, we've already talked about C. diff in the interview I had with Katie and Gina.
Yes.
But I wanted to talk to someone who on the front lines is dealing with that. So you're using bleach.
Yes.
For those patients while they're here and when they leave.
Yes.
Okay.
Yes.
Okay.
And then we use a robot, because I tell you what, I talked to a patient just the other day, and she was so happy to know that we had the robot, and the robot kills C. diff, MRSA, and all these other infections. They were very happy to hear that.
Now, when we say robot, just so folks know, because
I'm sorry.
No, it's all right. It's all right. So talk a little bit about what that robot does and how it does it.
The robot, we have one now, and it's about this tall, and it comes up, and we use it 15 minutes in the room, and it kills. It's ultraviolet light, and it goes around the room.
Sure.
And we put it in the bathroom too, and in the bathroom it gets it really, really well too. And it kills C. diff, MRSA, COVID, any of the infections that we
deal with
every day.
Yeah.
You know, and we had the robot before
Yeah.
we had COVID.
Yeah.
And so people are very happy about the robot because if they feel like it's an extra precaution,
Yeah.
an extra security for them.
Sure.
And so they're very, very happy about that.
Yeah, and just to clarify, I mean, if we didn't have a robot, your team would still do
Right, we would. We
It'd
would.
be a
But
good
this is
enough job,
second.
but just an extra layer of protection
Yes.
to what you're already doing for
Yes,
infection.
and from time to time, a patient asks me, and I give them a little bit of information, and I show them where their website is so they can look
Yep.
it up.
Yep.
And they're very happy about the robot.
Yeah, but they should be happier about you.
Yes, yes, yes.
Because your team does a
Yes.
great job of
Oh,
getting the room
yes.
clean in the first place, and then the robot just is a
Oh,
little extra layer.
Yes,
So.
yes, it is. Because
Yep.
I tell you, like, I've had one person ask me, "Do you just put it in there?" I say, "Oh no, we have to do everything first.
Yep.
Everything. We have to wipe everything, and then that's a secondary."
Right, right.
Yeah, but
Yep. So literally, this is one of the folks that on the ground floor helps to keep the hospital and our patients and staff and everyone safe. So Maria, thank you for all you do.
oh, you're welcome. Thank
you for being a good sport on short notice.
Well, thank you, thank you. I'm
All
glad
right.
we can educate people because it's so important.
It is. It is.
Yes.
Thank you.
Well, thank you.